it's hard for people to wrap their heads around because they're used to trying to take care of someone who has a mental illness. So the next part of this definition of mediation is that the values include self-determination, confidentiality, neutrality, safety, and quality. I'm not going to go too much into this except to add that the confidentiality piece is very important in mental health situations, although the people that we're training are not in as private of a setting. So any questions on that? Any comments? Brian, I can't see the comments as they come in, so is there a way you could indicate to me when there are ones?
I will do so, and any that get sent to me, I'll be happy to relay them. We did have a question that kind of relates to the mediation process from Derek, and he asked, who determines if a mental health patient is able to participate in mediation? Would that person also serve as a decision maker in the event of an agreement?
So I want to stress that there's a lot of moving parts here that I've talked to you about in terms of the work that I do with mental health and mediation. These trainings are really communication workshops. So we're not starting right now with fully developed mediation programs to take on these cases. We're really getting into the door, meeting up with these mental health communities, teaching them what mediation is, teaching them some basic skills related to mediation, and measuring the outcomes as a first step, start building relationships with different mental health communities, and to start demonstrating that there's value here in terms of collaborating about mediation and mental health. So that's what I'm going to start with there. I want to add also that after we give a training to different agencies, we will work with them to try to develop their own internal mediation program.